in your inbox saying you haven't been doing a good job when the day before you just got a stellar evaluation for your work. And also acknowledge how important your work is to the well-being of our country and our citizens. And also, just on an emotional level, all of us, when we have a job we like to do and work with people who we trust and value, and this is true, of course, for you, that's a great joy in life, to be able to help others and to have a team that you're working with where you share that goal of making the world a better place. So it's astonishing to me, the level of cruelty that has accompanied the lack of wisdom, actually the recklessness that has been so much a part of the Doge philosophy, where you shoot first and aim later. So I just want to acknowledge on behalf of my colleagues in the Senate and Senator Baldwin, who's the co-chair and the leader, really, of these hearings, but can't be here today, but will be here. We're doing this again tomorrow. The whole point of what we're doing is to try to bring to the attention of the American people what the reality is of the Trump administration attack on the federal workforce, on many federal programs. These are programs that are not abstract in what they do. They really affect the lives of young people and the well-being of the health of our country. And these things have to be built over time, you know, to get the expertise, to have the infrastructure, to have an established set of procedures where you can actually deliver services that make a difference and where that work can be continued by those who follow you in your positions. And it's a real threat because when you erode that foundation that has been established over time in an institution, it's not as though a year later, 2 years later, you can come in, flip the switch, and we're back to the way we were. Damage is done. And it's very important that we be concrete and explicit in our outreach to American citizens so they can evaluate what has happened to things that are really helpful and very important to their well-being and ours. So today we have panelists, and we're going to hear 5 minutes or so from each. And we'll get started in order, and then on a rotating basis, I expect some of my colleagues to come here and have some questions to elaborate. But just by way of quick introduction, Robert Califf, thank you for being here. Food and Drug Administration, where you serve FDA Commissioner. That's a big job. Okay, thank you. And Meg Sullivan, pediatrician, who I guess the bad news is you're not the administrator for children and families. The good news is you're treating pediatric patients. So thank you for being back doing your work. And Chiquita Brooks-LaSure, huge job at CMMS, the Center for Medicare and Medicaid Services. You were actually qualified to do the job. I'm not sure I can say the same with your successor, but thank you so much. And Carol Johnson, Health Resources and Services Administration. We look forward to hearing from you, and thank you for all the service you've provided in that role. We'll start, Dr. Califf, with you. Thank you very much.
Thanks, Senator Welch, and it's good to be with you today, although not my favorite occasion, I must say. And I do appreciate the opportunity to talk about the impact of the cuts that have occurred in the federal workforce on the ability of the FDA to meet its mission of preserving and protecting the public health. The multiple rounds of firings that have occurred have had a significant impact on both the physical ability of the FDA to do its work and the morale of the organization. To my knowledge, the actual number of people who've been fired is not known, although it likely exceeds 3,500 people, with at least 1,000 others actively negotiating regulated jobs elsewhere. The methods used so far by the current administration have violated almost every principle of right-sizing an organization. And in my previous jobs across various industries and academia, I've unfortunately had to do downsizing a number of times when the budget couldn't support the number of people. Good people have been fired via email with bogus statements about their job performance, with no discussion or recourse, and minimal to absent resources to help them make a transition or to hand off the work. Then when basic functions couldn't be accomplished in their absence, people were called back to work, sometimes permanently and sometimes just to complete specific tasks. Somewhat insulting, I must say, to good, solid workers. In the midst of this, the HHS secretary showed up in person and called them, quote, sock puppets of industry, unquote, to their faces. It's hard for me to imagine a more effective approach to demoralizing a workforce. The most vivid depiction of this situation was when a pundit opined that the FDA had been, quote, decapitated and eviscerated, unquote. Because the FDA is where the rubber meets the road in government oversight of such a large part of the economy, the press and you as Congress have understandably focused on the high-profile decisions made by FDA. However, the vast majority of FDA's work is never heard about and requires a complex and highly professional interaction across multiple disciplines within the FDA and across the regulated industries over long periods of time. These industries depend on predictability of the FDA to plan their business functions. This means that multiple issues could arise that would not see the light of day until something obvious happens to the public health. Indeed, this has been the history of the FDA. Many people wonder why we need all these regulations and people until something bad happens, and then people wonder why no one prevented the problem. In the interest of time, I'll give two brief examples, and I'll submit to you and to my Substack, which is active and thriving right now, a list of areas of concern with regard to every commodity regulated by the FDA. The first example is medical products. It's a long and complicated path to develop a medical product. 9 of 10 drugs that enter human clinical trials don't make it to market because of unexpected toxicity or there's no benefit that's achieved despite the amazing strides we've made in understanding biology. During this multi-year course of development, multiple meetings occur between the FDA and those who are developing the products because the FDA has insight into the entire spectrum of people developing similar products and can guide the industry to stay away from aspects that might injure human research participants or lead to large expenditures of money to dead ends that would not work. Secondary is food inspections. It's sort of been depicted that an inspector is like called an investigator at the FDA, is like a rugged individual who shows up one day and does an inspection. It couldn't be further from the truth. There's a need for an entire team of people across multiple disciplines to prepare the needed information, to work on the logistics. Imagine going to a country in South America to show up at a facility of what needs to be done. And so any chink in this inspectorate team, any lapse could lead to a foodborne outbreak that would be a matter of great public concern. The bottom line is that the firings have left the FDA with not enough people to do the work and with the loss of many of the most experienced people in making the complex judgments needed in the day-to-day work of the agency and multiple regulated industries. In addition, an agency that was previously near the top of morale for all federal agencies and the annual assessment that's done is struggling with morale issues because of the inhumanity of the firings and the multiple public statements about the federal workforce in general and the FDA in particular. This creates a risk at every step of these important issues. Finally, I'd be remiss if I didn't mention something that everyone's talking about. These issues are leading to, first, many aspects of the industry is looking to go overseas to develop their products. And perhaps most importantly, China is now emboldened to overtake the United States in the infrastructure needed for this vital part of our public health and the economy. Thanks for giving me a chance to speak.
Although very alarming what you had to say. Thank you.
Great. And thank you so much, Senator Welch, for inviting me to be here today to discuss the devastating impacts of this administration's firings and reorganization of the U.S. Department of Health and Human Services. Again, I'm Dr. Meg Sullivan, a pediatrician, and served in the role as the Acting Assistant Secretary for the Administration for Children and Families, or ACF, during the end of the Biden-Harris administration. ACF is an agency of the Department of Health and Human Services that is responsible for administering programs critical to promoting the well-being of children, families, and communities, including the primary federal child care grant program, Head Start, family assistance, child support, child welfare, homeless youth services, family violence prevention programs, and home heating and cooling assistance, among so many others. ACF programs provide essential services for millions of families every day throughout the country, and the impact of its programs is deeply felt in every community around the nation. Yet despite the critical need for family services around the country, since January, over 700 ACF staff have been pushed out the door, 5 of 10 regional offices have been shuttered, and many of the nation's top child well-being experts have been pushed out of their jobs. The agency that stands up for kids has lost approximately 40% of its staff because of the administration's aggressive firings. And to further compound the impacts, budget cuts and eliminations have been proposed for critical programs that threaten family economic stability and further escalate the immediate threat to child well-being and safety. I strongly believe we must continually work to improve government programs so American families and communities can prosper. But ACF was already leanly staffed by dedicated experts who worked hard every day to improve the well-being of children and families, and gutting the staff that administer ACF programs will make children, families, and communities suffer. In addition, when the programs are cut or disappear, everyone feels the impact, and longer wait lists, fewer providers, and local organizations stretch to the breaking point. Today, I just want to spend a few minutes highlighting some key examples. First, the Low-Income Home Energy Assistance Program, or LIHEAP, is a life-saving program that is critical to supporting the health and well-being of families by helping some of America's poorest families heat and cool their homes and provide relief from rising utility bills. Despite the importance of this program, the Trump administration fired the entire federal LIHEAP staff, meaning there are currently no federal LIHEAP staff to properly administer the program and provide oversight to ensure program requirements are met as required by statute. In addition, the Trump administration's FY26 budget proposal seeks to eliminate the funding for LIHEAP. Elimination of this program would cut off energy assistance to 6 million households and force parents to choose between basic services like food or heat in Vermont, or in rent or air conditioning in Arizona. ACF also administers the Head Start program, which provides high-quality early education to 800,000 children. Head Start grantees draw down funds in real time to pay teachers, serve meals, and purchase classroom materials. However, since the start of the new administration, Head Start grantees have experienced funding delays, and the closure of 5 regional offices have left many Head Start programs with limited communication to help them navigate these delays. The impact of these harmful changes the Head Start programs are already experiencing are far-reaching, but I'm just going to highlight 3. First, a handful of programs have already had to temporarily close, leaving families in a lurch when they suddenly do not have childcare. Second, teachers are worried about job security, and some have left. And without teachers, classrooms close and fewer children are served. Finally, Head Start programs are worried about future funding and have canceled or delayed contracts for things like facilities maintenance, which hurts local businesses. ACF also administers the federal child care program, which benefits nearly every child in a child care program across the country. Not only does it help nearly 1 million families pay for childcare every month, but the program also sets and enforces the minimum health and safety standards for most childcare, and is critical to funding state childcare licensing systems and state efforts to make childcare more available and more affordable. However, about half of the Office of Child Care federal staff have been pushed out the door since January, which will and has deeply undercut federal efforts to support safety standards, improve parents' child care choices, make it easier for families to participate in the federal program, and work with states to address their own specific challenges and priorities for families needing care. Gutting office operations in this way means ultimately child care will be less safe, more expensive, and harder to find for millions of American families because the federal law simply will not be able to achieve all that Congress designed it to do. In other areas of ACF, all staff who administered the Social Services Block Grant were fired, though states rely on this critical program to fund economic self-sufficiency efforts to prevent or address neglect, abuse, and the exploitation of children and adults. All in major staff cuts to federal staff overseeing child welfare, foster care, and adoptions, and runaway and homeless youth threaten to put children and youth at increased risk of abuse, chronic neglect, and entry into the foster care system. We'll just conclude by emphasizing that ACF programs, including those not mentioned just now, support the services communities rely on in every corner of America. They can be the difference for your child care center staying open, your local diaper bank having supplies, meal delivery for older adults, or a child remaining safely at home. We should be investing in our children and our families, but firing child well-being experts at ACF and proposing senseless cuts will unquestionably cause them harm. Thank you.
Army, thank you very much. Ms. Brooks-LaSure.
Thank you so much for inviting me, as well as my fellow colleagues, to speak today about the impact of HHS workforce cuts on our respective agencies. I could talk at length about the harm these cuts will have to the Centers for Medicare and Medicaid Services' current operations. However, I believe it is my duty to instead discuss these cuts in the context of the House reconciliation bill that poses a greater threat to the functioning of both Medicaid and the Affordable Care Act marketplaces, and by extension, the people these programs serve. CBO and JCT preliminarily estimate that at least 14 to 15 million people will lose their health care coverage as a result of the House reconciliation bill, a number I suspect will be even greater when we account for CMS staff reductions that could hinder oversight. The current proposals drown both Medicaid and ACA marketplace in extensive red tape that will hurt everyone, including seniors, mothers, children, those with disabilities, and it will cause more uncertainty, more churn, and more people delaying life-saving treatments. We have already learned this lesson. After the pandemic, many people, including children, eligible for Medicaid and CHIP, lost their coverage through difficult renewal processes that required a coordinated effort from states, health plans, advocates, and CMS to get them re-enrolled. A Harvard study on Arkansas's work requirements found that 95% of Medicaid enrollees met work requirements, were in school, or otherwise exempt, and yet 30% lost coverage. And if these people lose Medicaid, they will not only face more red tape trying to enroll in marketplace coverage. In fact, the current provisions in the bill will drastically destabilize and lower the competition necessary for the marketplace to provide adequate coverage to the over 24 million people enrolled. At the same time, if enhanced tax credits expire, premiums could increase by over 75%. Many of these proposals will take effect in a little over 6 months. One of the proposals is ending marketplace auto re-enrollment, which requires all marketplace consumers to actively recertify eligibility for healthcare coverage every year. This provision alone could destroy the market and make it unattractive for plans and providers to participate. No other insurance market does this. Not employer-sponsored insurance, not auto insurance, none. As people try to navigate through this red tape, CMS has fired the very people who were hired to help consumers, like the over 100 staff members fired from CMS's Office of Program Operations and Local Engagement, marketplace navigators, and marketplace probationary staff. The bill also includes a provision that eliminates the cap on the dollar amount the IRS can recapture for individuals who overestimate their income and are covered through the advance payments of the premium tax credit. We design APTC coverage to be predictive rather than retroactive, because if people only receive these dollars at the end of the year, most of them would never be able to afford insurance to begin with. And we put these caps on what could be reconciled because it's hard to predict your income if you are self-employed or in a seasonal or hourly job. Let me give you an example. If a single woman opens her own bakery and predicts she'll make $25,000 a year, but she receives more business than expected, this is a good thing, she would increase her income to $40,000. But yet now, under this bill, she would owe almost $1,700 when she files her taxes, which would be a 78% increase. For people starting a new business, this amount of money can be critical for their business's success. The proposals in the House Reconciliation Bill that target both Medicaid and the marketplace seek to undermine the very progress that the Affordable Care Act sought to achieve in making our healthcare system more affordable and accessible to everyone, regardless of their income or healthcare needs. The bill aims to increase friction in that healthcare system for enrollees and does so at the same time that many of the staff who could help reduce these frictions were fired. These changes will not only hurt the millions of people that rely on these programs, but on our providers and, in fact, our entire healthcare system. Thank you.
Thank you very much. Ms. Johnson.
Thank you, Senator, and thank you for convening today's discussion to shine a light on the dramatic changes that are occurring at the Department of Health and Human Services and the implications for the health and well-being of all Americans. I'm Carol Johnson, and I previously served as the administrator of the Health Resources and Services Administration. The Trump administration has announced its intention to eliminate HRSA, and the president's proposed budget for fiscal year 2026 zeroes it out. To put that in perspective, HRSA is the HHS agency that supports federally qualified health centers that provide healthcare services to 32 million people in the nation's highest need communities, trains and deploys tens of thousands of new physicians, nurses, dentists, mental health and substance use disorder providers, and other health professionals annually, helps rural hospitals remain viable and builds physician training capacity in rural areas, provides life-saving drugs and treatment to more than 500,000 people living with HIV, and leads the fight to combat maternal mortality, including running the National Maternal Mental Health Hotline, which has answered more than 50,000 calls and texts from new moms. Rather than strengthen this essential safety net, the administration is prioritizing dismantling it. The administration has already slashed health center program staff, put the widely acclaimed pediatrician who oversaw maternal and child health programs on leave, fired the transplant surgeon recruited to help reform the nation's transplant system, and eliminated entire offices that are essential to any organization like HR and communications. The grantee impacts are growing rather than abating. Community-based groups with small margins that have experienced delays and confusion accessing the HHS payment portal for funding that was already awarded. Grantees received a series of confusing and conflicting notices that were issued and then withdrawn about what the new administration deemed an allowable grant expense. Now there is uncertainty about whether the administration will follow through with Congress's intent to continue fiscal year 2024 funding into fiscal year 2025 for current grantees. And of course, there are the challenges that have resulted from the skilled HRSA staff being fired and critical work being disrupted, including, for example, the firing of the staff that managed the National Maternal Mental Health Hotline, the firing of the technology experts who were implementing Congress's vision of a modernized organ transplant network, and the firing of the entire team that has been working with health centers to revolutionize how healthcare quality data is reported and used to improve health outcomes. It appears that the remaining HRSA teams are doing their best that they can to develop interim workarounds to keep key initiatives afloat, but these dedicated public servants can only do so much when the headwinds are against them. And although there is no public plan detailing the proposal, the administration has said that it intends to create an administration for a healthy America, which they say will salvage some HRSA functions. However, I'd like to share a few examples of the many HRSA programs that are set to be completely eliminated in the president's fiscal year 2026 budget. One, addressing healthcare workforce shortages. I was proud during our tenure that we grew programs and trained so many new physicians, including launching a new program in Senator Baldwin's home state that funded our first rural obstetrics and gynecology residency program at the University of Wisconsin as part of our comprehensive approach to address maternity care deserts in rural area. The Trump administration intends to eliminate this and many other health workforce programs. Two, tackling the maternal mortality crisis. HRSA launched the first of its kind maternal health research collaborative of and by the communities most impacted by the maternal mortality crisis, led by Morgan State University and Senator Alsobrooks' home state, and including Morehouse, Meharry, Tennessee State, and other minority-serving institutions. The Trump administration would shutter it. Three, keeping rural hospitals open. In your home state of Vermont, the HRSA-funded State Office of Rural Health is the one-stop shop on all things rural, and Vermont has the Vermont State Office of Rural Health has worked to leverage other HRSA hospital funding programs to support the state's critical access hospitals and build capacity to help keep hospitals viable in your state. And the Trump administration would end all of these programs. And 4, helping new moms and babies to thrive. HRSA provides high-touch supports to pregnant and new moms in high-need communities, and moms from Maryland and Georgia and Illinois and Arizona have repeatedly talked to us about the transformational power of the HRSA Healthy Start program, and the administration intends to eliminate it. The rest of the elimination list is long and includes work on autism, sickle cell, ending the HIV epidemic, training new nurses, training new mental health providers, expanding the number of geriatricians in the country, and much more. Of note, many of these were programs that the president supported in his first term. If the current administration follows through on his plans, HRSA will cease to exist, and the families and communities in your states that most depend on this help will lose it, just as the majority looks to make it harder for them to get and keep Medicaid coverage. The safety net may never have been more fragile than it is at this moment. Thank you for the opportunity to join this conversation with my colleagues today. I'd also like to share my appreciation for the remaining HRSA team that is navigating the current uncertainty and trying their best to continue the mission. I look forward to your questions.
Thank you very much. You know, this is incredibly alarming. There's a through line as I listen to each of you. This assertion that this is about efficiency and getting rid of waste, fraud, and abuse is not on the level. I mean, because as I heard you, there's a hollowing out of the infrastructure, and that's personnel, its authority, its resources that are minimally required to do the job, as opposed to, and one of the challenges we have is we spend the most on healthcare and get the least in our country. So trying to find efficiencies, what things cost, how you deliver care, community health centers, that's all really important stuff to do, but it has to be from the framework of making healthcare available as opposed to saving money by making healthcare impossible to reach. That's what is so alarming to me. I'm going to start with you, Dr. Caleb. You know, one of the things we're having real challenges with on prescription drugs is the cost. We are so lucky to have our new Senator Alsa Brooks here joining us. Thank you. It's so good to be with you. Do you want to make a few remarks before we get started? Folks just gave incredible testimony. And it's good news, bad news for you, because if you were here, you'd be depressed. Okay. Hearing from what they said, but you'd be also inspired by the incredible work they did and their commitment to carry on in the face of what's happening. Yeah.
Wait for you.
Okay. All right. I was just going to start asking questions. You know, the prescription drugs, I have a concern about how expensive they are, but the good news is they work. And we want to make them more accessible. And what I heard you describe was this: what is going on at the FDA. There's a significant incentive for the creative work that's being done here, the scientific research, to move over to China. Did I hear that right?
I think you got that right. You know, one great thing about being FDA commissioner twice, there are a lot of bad things about it, but one great thing about it was anywhere you went, people said the U.S. is #1 in innovation. We're creating the products that, in many ways, other countries are using better, which accounts for a lot of the reason that we have a 5-year shorter life expectancy. But we are the fountain of innovation, creativity, startup companies, and the system, you know, has been highly effective. But if you're given that the life cycle, if you want to develop a drug, you start out with all the preclinical testing, you do phase 1 clinical trials. As I pointed out, 9 out of 10 times it doesn't work despite all the brilliance of our science today. So you need a 5 to 10 year runway of having confidence that when you do that project, you're going to get to the end of the road, and if it does work, it's going to be okay. So what I'm hearing from a lot of the biotech community especially, and pharma and device companies, is looking overseas to land their programs because there is much more stability in the regulatory systems there. But then you get to China, which is, I did a lot of work in China in my previous life. I hope we all get along with people in China. There are a lot of good people there, but right now their government is all out trying to take over the #1 spot in biomedical science. And it's not just new products, it's the whole infrastructure, the NIH, which I know you're going to talk about tomorrow, that provides a basis on which all these discoveries are made. And so we've got a real problem if we fall behind in that regard, because almost everyone that's looked at the future economy agrees that whether you're talking about curing diseases or bioengineering of crops in a time of stress on the climate, this is going to be a critical element of success. And we've been #1. I grew up with Duke basketball. I apologize, but it's just the way I am. I know we got a Maryland fan here probably, but
No, I'm a Blue Devil too.
okay, good.
Yeah.
All right. So, but when you're #1, you better know what you're doing before you tear it down and start doing something different. And that's what I'm really worried about. We're tearing apart something which is acclaimed all over the world as the system that's creating the new products for the whole world.
I'm going to thank you very much for that. I have to go to the floor for a few minutes, but it'll take a while to get there. So Senator Alsobrooks will be taking over. And I did want to ask you about LIHEAP, but maybe, because that's really near and dear to us in Vermont. But I'll leave it to you, and I'll be back.
All right.
Thank you.
Okay. Well, first of all, want to say thank you so much to Senator Welch for facilitating today's discussion. I know we will be joined shortly also by Senator Baldwin, and I'd like to say thank you so much to each of you, to our esteemed witnesses, for being here today. Dr. Califf, I have to confess to you, in this area, I've done the very dangerous thing. I went and made myself a Blue Devil as well. As you know, in Maryland, Blue Devils are not popular at all. So this has been a very controversial thing, but we are working through it. What I can tell you is, I want to really thank you for sharing your time with us today. This has been a really, really difficult time for so many of us as we watch the actions of this administration. It has been just breathtaking, is what I can tell you, in terms of what they have done to dismantle our public health systems. And for me in particular, because I am a part living in Maryland, where I believe NIH is a crown jewel, not just of our country, but it's the crown jewel of the world. Some of the finest doctors and scientists are there, as well as Johns Hopkins and many other places. It is really a part of what makes America exceptional. Science and the work that we have done in healthcare really has made us, it's a part of America's exceptionalism. It's why we lead, and to the point here, is an area that we should continue to lead. So I want to thank you for your service to the American people. I know it hasn't been discussed in that way, although it should. The people who have been fired, the men and women who have been unceremoniously fired, are people who have shown up each day, not asking whether they're serving on behalf of a Democratic or Republican president, but they have been there to serve the American people. They don't care the party. They are there to serve the people. And you all answered the call to serve and continue to do so with your willingness to expose how this administration's actions do threaten the health and well-being of the American people. I spent hours last week at a HELP committee hearing and listened to Secretary Kennedy, who was there at that hearing, and he proved, in my opinion, yet again, why he is unfit to serve in the position that he's serving in. He should be, for so many of our families who should be able to look at our health officers and trust the words that he speaks, he should be a trusted leader and an authority on science and evidence-based health practices. Yet last week, what we saw instead was that he literally told one fallacy. When I grew up, my grandmother wouldn't allow us to use the word lie. She would say we had to tell stories, and he told one story after the next, one fallacy after the next, spewing dangerous rhetoric about vaccines, and showing really alarming disregard for the vulnerable communities that his department served. And so I've never seen someone so blatantly not just lie to the Senate, but to the American people. And it appears to me that he believes that if you tell a story then it becomes the truth. And the New York Times fact-checked him again and again after the hearing. Mr. Kennedy made the assertion, for example, that he had not fired any working scientist, and he reasserted that again and again, and we know that it is patently false, that there have in fact been, unfortunately, hundreds of scientists from NIH, FDA, CDC, and FDA who have lost their jobs as a part of his plan to overhaul the department. And I know it personally as well because I've met many of the scientists and researchers. One is here today, raising her hand, who have been summarily dismissed, many of them after decades of public service. And so these stories about critical research that has now been handicapped by reckless layoffs is horrifying. These are stories about the human services programs as well that are no longer serving families in vulnerable communities, yet the Secretary is telling the American people that these scientists and public servants have not been harmed. And so, we thank you for being here today. I have now been joined as well by Senator Wyden. I'm going to hand it over to him in just a moment. But again, we want to thank you for helping us to highlight this issue for the public. The department's reorganization and reduction in force has been simply devastating, most especially to Maryland. It is, to me, it's infuriating. And I thank you for allowing us to highlight this issue for the public. And so thank you so much to Senator Wyden, who has joined us, and I'm going to hand it over to you now.
I thank my colleague from Maryland. I think she knows we have the NBA All-Stars of healthcare policy with us, and we're very pleased to have you here. And just a couple of questions, if I might. I'll start with you, Ms. Brooks-LaSure. I thought your recent article talking about how the far right is making it harder for eligible people to get their eligibility certified for healthcare services. And I think this is a message that needs to go out far and wide, and probably the one area where it's taking a huge toll right now is the office that deals with duals, where we have folks who are eligible for Medicare and Medicaid. You and I have talked about that. It goes back to my days with the Gray Panthers and the like. But tell us a little bit about why this recent scholarship of yours is so important and what it means at the duals office.
I think thank you so much, Senator Wyden, for your question. As we have seen time and time again, it is so important for us to work on making it easier for people to enroll in coverage rather than make it more difficult. And during the 4 years of the Biden-Harris administration, we did incredible work to try to raise the standards for states to try to make it easier. And that's why we were at the lowest uninsured rate in our nation's history. Dual eligibles make up some of the most vulnerable people in our country. And there have been discussions about how nobody who has a disability, our seniors, are not going to be hurt by the cuts to the workforce or to in this legislation. It is crucial that we make sure that we are paying particular attention to dual eligibles. They're between two different systems, Medicare and Medicaid, and that's why there was a duals office created to focus and make sure that we're always looking at both programs and coordinating. And it's imperative that we continue to make sure that people get the care they need. One of the reductions in staff is casework. So when you would call me and say, I need help, it was our regional office that would also often be the ones who would be on the ground resolving those issues for people.
Well, I think you've written a lot of good articles over the years, but this was particularly, poignant because this is how you're going to make a big difference for people. The far right is always saying the big challenge, if we're going to save money, is waste, fraud, and abuse. Now we're seeing that's not their main strategy. The main strategy is what you wrote about, which is screening people out of the process of getting signed up and becoming eligible. So Godspeed. I'll look forward to using those articles in the Finance Committee in the future. Dr. Califf, welcome to you. We also go way back a lot of years. And what I wanted to ask you, I think you and I have talked about, in 1990, I held the first hearing in the Congress on mifepristone. And it was at a little small business committee nobody had ever heard of, but that was how we sort of got the ball, rolling. I'm curious what you think about the politicizing of these scientific and medical decisions about mifepristone and how much it's going to set back our country if it's successful. What happened in 1990 is we teed it up for Bill Clinton to basically say, we're going to do science, not politics. That's what's going to govern drug approval. And there we were for 20 to 25 years having that as our lodestar. And now we're threatened by having to turn back the clock and go back to something where we're basically fighting off, politics. And tell us what you think the implications of that are.
Well, I think if you look back at FDA commissioners all the way to all the living commissioners, we talk with each other still fairly frequently, whether appointed by Democrats or Republicans. One of the real cardinal elements of being commissioner is protecting the civil service to make the scientific decisions about risk and benefit. Because once you open up political control or influence over those decisions, who knows what could happen next, depending on just who happens to get appointed. And as I've already pointed out, if you're developing products, you need consistency over time, not people coming and going with very different points of view about what should happen. Now, I hasten to point out, no decisions about mifepristone have been made that I know of at this point. There's just a lot of rhetoric, but it would be very dangerous for politicians to be making these decisions. There's a staff at FDA that scientifically judges risk and benefit by a set of criteria. I've often said the FDA is more like a referee than it is like the owner of the team. You guys are the owners of the team. You make the laws. And then the FDA uses the criteria that you put down to judge risk and benefit using the advantages of modern science. So I'd be really surprised if anything about mifepristone has changed. There's a lot of data that's been looked at already within the FDA, and I know there's one study that's been mentioned that it's not even published, I don't think, that had a lot of faulty methods in it that are being touted by people who say it should be looked at again. But I think no matter how many times you look at it, if it's judged by the scientific criteria, you'll end up with the same result.
That's way too logical for some of what's going on back here.
I will say, I do think RFK has been alluded to already. I will just say, somehow he feels that the Secretary of HHS should be reaching down in the level of making decisions about individual products, which has only happened maybe once or twice in the entire history of the FDA. And for all the reasons I gave, I think it's a very dangerous precedent, especially when you have someone who, for example, has written that viruses don't cause diseases. I mean, he's not a scientist, he's not a physician. So I hope we can get the politics out of these decisions.
I thank my colleague.
Thank you so much, Senator. You know what? I'd like to just ask a question as well of Dr. Califf regarding vaccine approvals and some of what we've seen. Novavax, for example, is a Maryland-based company that's been waiting for long overdue action from the FDA on its updated children's COVID-19 vaccine. And this delay has serious consequences for so many in our state, not just for a company who's employing hundreds of Marylanders, but for families who rely on timely, science-based guidance and access to vaccines that they can trust. And so I wonder if you can speak to the impact that these delays in the vaccine approval process will have both on public health outcomes as well as public trust in the safety and efficacy of our nation's vaccines.
Well, one of the things that's taken very seriously by the FDA, upon which the user fee system is built, is a schedule of timelines. It was intriguing to me as a commissioner. It's more like running a business, which I've done a lot of in academic medicine and health systems, and also in tech, because the amount of work and effort it takes to make a judgment is pretty well specified And those timelines are looked at carefully and are almost always met. As we've already discussed, the disruptions that occurred in the firing of so many people, plus whatever else happened with people with political appointments putting their own judgment into this, led to a delay in the particular case that you mentioned. And if that happens over and over, as we've discussed, it will erode the primary position of the U.S. as the leader in biomedical science and biotechnology. Very important to our economy and the future of our people. So I hope that there is a plan to reconstitute the scientists and people who have been fired to be able to get this job done.
So, also, want to ask you, so what do you think that the FDA can do to ensure that the review process remains rigorous, but is also responsive to the urgent public health needs?
Well, I feel like the review process has worked so well. I haven't heard many complaints about it. And one thing I pointed out in my earlier comments was, we tend to focus on the products that actually make it to getting an application sent in, and there's a lot of scrutiny and publicity about that. That's sort of getting across the goal line. But the vast majority of products never make it to the goal line because of the interactions that occur. And if you're, for example, putting hundreds of millions of dollars into product development and it's not going to make it, you want to know that as quickly as you can, partly because you don't want to subject human beings who participate in research to the risk if it's not going to be a successful product. So this entire process is not just a matter of reviewing an application. Mm-hmm. It's an interactive process that goes on for many years. And I just wrote about a case that I thought was fascinating. There's a lot of work being done on an HIV vaccine, and many of us have been hoping for years. I was an intern at San Francisco General in 1978 when the first cases of AIDS were being seen in my inpatient unit that I worked on. And it looks like real progress is being made, but lo and behold, in phase 1 trials, rashes appeared, which are not lethal. But that's a sort of a great example of, okay, when that happens, do you go ahead and spend the hundreds of millions of dollars on development, or do you stop, reformulate? All of that involves the scientists in the company and the experts at FDA working together. So if we don't replenish the scientific staff and have adequate numbers of people, the damage that will be done is something that wouldn't be seen until years later when we don't have the pipeline of products that we need, or we're letting products on the market which actually cause harm and not benefit.
So we've been joined now by Senator Klobuchar, and I want to thank her for coming by. I want to hand it over to you now.
Thank you very much. Welcome, all of you, and thanks for helping us out here to understand what this all means to our constituents, which I think it's really important to make the case. Good to see you again, Dr. Califf, only because we've done a lot of work over the years together. I am really focused, I guess I'd start with you. I'm thinking of Senator Alsobrooks with NIH and all of the research and what this means for our economy. And one of the things that troubles me, I think, is when we talk about, say, cuts, we have to start talking about what it means to people. And when you don't have enough reviewers at the FDA to look at complex medical devices, you step backwards because things aren't going to get approved, or something gets approved without a thorough review. And it's one of the most amazing things how we're on this cusp of, I would say, a next generation of technology because of mapping the human genome, because of AI, if harnessed correctly, all these things with rare diseases, and yet they're going backwards. Could you just talk about that more macro issue of how not having reviewers or scaring people away from the workforce because you diss the workers, even if you don't fire them individually, the effect that could have on America's economic future?
Sure. I'm spending more time than I wanted to paying back what I call debts that I had when I was commissioner. I couldn't go out and give talks at universities except, at particular times. So I've been all over the country, and I think there's a general agreement in the biomedical, scientific, and patient communities that we are at the most exciting time in the history of the possibilities that we have to cure rare disease and to do a lot about chronic diseases. And a big part of that you referred to is the evolution of devices now from sort of mechanical instruments to now instruments that are armed with artificial intelligence and digital technologies of all types built into the devices. And you spoke about reviewers, but again, as I've been focusing on, it's not just the reviewer who's looking at the data coming in. It's all, in the case of devices, it's the biomedical engineers, the physicists, the quantitative scientists, the data scientists who are
Right.
working with the companies all along.
Or working
to
with
get this
places like
right.
Mayo Clinic in Minnesota with the research,
Absolutely.
which was so integrated with NIH.
But also, I mean, you asked about a macro thing, and I want to pull in colleagues here because I'm spending a lot of time with the rare disease community, which we all should, because now, after decades of investment at the NIH, we have the ability to edit the genome for these children who
Totally.
have no hope. But it's not as if they're all going to be cured right away. It's very expensive right now, and many of them will have chronic diseases. And the support for these communities is being taken out through my colleagues' efforts here that were underway. If you have a child with a rare disease, you're typically dependent on Medicaid for all sorts of services that people just take for granted if they're healthy and don't realize are so important.
What I remember, the cuts center-wide in the first week of the changes at HHS, the rare disease, Senator Wicker and I head up the Rare Disease Caucus, and all the families were out here for their annual conference of looking at the intersection with NIH and FDA, and they canceled the whole conference, and they were already here. So, we met with them. One last really quick thing, FDA offices, food safety, Minnesota's the home of Dr. Osterholm, who predicts a lot of really scary things and pandemics. But when I saw him about a year ago, I asked him what he thought the next big pandemic would be, and they were honestly animal-related diseases. And just very quickly, because I want to ask Dr. Sullivan one question, just what you think the effect of that will be.
The effect of
Of FDA cuts in
Oh.
terms of the offices, in terms of looking at food illnesses and the root causes of them.
Yeah, as a point I made earlier, also, the food system is dependent on interactions that occur at every single level, the farm, the distribution system, the county, the state, and the federal government. They all have to work together. And the idea that you could go from Washington to Minnesota and take care of all the problems is ridiculous. But it's also ridiculous to think that Minnesota can handle everything on its own. We need a national system
Right.
that's highly coordinated, and it just takes people.
Exactly.
One thing I worry about a lot is in the DOGE apparatus, and I've worked in Silicon Valley for 5 years, as you know. When a software engineer is turned loose with no content expertise, you get all kinds of crazy things like saying that 150-year-olds are getting
Yeah, got
Social
it.
Security. But when
get
a
it.
software engineer works with content experts,
You can
it's
get
magical
some
when it comes
magical
together.
things. I get it. Last question, just Dr. Sullivan, and my job as head of the Adoption Caucus. We've seen, and the Congressional Coalition on Adoption, we've seen these concern about how mass layoffs will impact Children and Families Children's Bureau, which, as you know, helps to eliminate barriers to adoption. Can you share the impact this could have on adoptive families, both with kids? Well, most of them are domestic adoptions, right? And then we work with the State Department and others on the international adoptions, but just talk about this.
Yeah, first, thank you so much for that question. And I think, when I spoke earlier, the range of services that the Administration for Children and Families provides is so vast. And I'm glad that you brought up, adoption, which we know is such a crucial one and so important in so many circumstances. And I think as we look across what is happening across ACF, what I said earlier, 40% of the staff have been pushed out the door since January. So the repercussions are just everywhere. And that includes, as you mentioned, the Children's Bureau, where staffing cuts, including those to regional staff, make it harder for local agencies and staff to find resources and access funding that support things like child safety, stability, access to services, including adoption. So just the staffing firings alone, the ability for those programs to contact, to get the technical assistance, to get the oversight, it really is heartbreaking, right? And that's not to mention every other program.
Senator Klobuchar, can I
Okay,
just be
thank you to Senator Welch. I know he's not here, Senator Wyden.
I'll be very quick because Senator Warren hasn't had a turn. I'm the senior citizens guy, but I will tell you, I was recently home and I saw the devastation that we're seeing with Head Start. And that has been a special area of expertise to you, Dr. Sullivan. And apparently what's going on is they're stalling all the payments to Head Start. So I had planned a community meeting and all, and then we heard that they weren't getting their payments. So I spent a week just making calls nonstop, and they finally gave in because they didn't want to get bad press that day. And everybody comes in and they're clapping, yay, Ron, he got us the money. And I said, not so fast. Look at the budget. The budget is for cutting back very dramatically on all of these programs. So you're the expert on this war on children, and I thought maybe it'd be good to have your assessment of the toll that we're seeing on Head Start with all this.
Yeah, thanks for that question. Just we've had our office shut down, I know, so.
Yeah, I mean, I think that for Head Start, since the start of the new administration, as you mentioned, both of you, the threats have been relentless. So the federal funding freeze, the loss of regional offices and staff that are just so vital to the program. We still are seeing delayed funding awards, banning initiatives that support community-oriented, culturally responsive practices, lack of transparency. We've had so many examples that I could provide right now. Head Start programs across the country, Washington State, New York, and Wisconsin are just a few that have had to temporarily close due to funding delays. We know when Head Start programs close, that means that parents are scrambling for childcare or have to risk missing work, many of whom work on an hourly wage and require that. We know parents are worried about the future of Head Start and what instability might mean for their program. But we also know that for these programs who are not getting the information they need or the funding that they need, staff are leaving because they are worried about losing their jobs. Programs aren't continuing contracts, which are hurting local businesses. I mean, the list of what is happening with Head Start right now is really, really, really concerning. And I think from what we've seen with all of the ongoing lack of staff and lack of transparency, I'm just worried that it's going to get worse.
You three have my proxy. Thank you all.
Thank you so much. We've been joined as
Senator
well by
Warren.
Senator Warren. Want to thank her so much, and we're going to hand it over now.
Well, thank you very much. Thank you, Senator also Brooks, for presiding over this, and a thanks to Senators Welch and Baldwin for pulling this together. Also want to thank all four of you for being here today. It is so important that we let the American people know what's going on. I think it's really worth underscoring that voting on this bill that they're pushing forward with these cuts occurred at 10:30 on a Sunday night with as little notice as humanly possible in a place like this, and that they're doing a follow-up vote at 1 in the morning on Wednesday. If you think you're doing something good, especially in Washington, you do it out in public. You do it right. You do it with your arms wide open, with the lights on, at a time where people can tune in and watch. These guys are trying to slip through this bill in the dark, in the middle of the night, when they hope that no one will be watching. Because when we start to talk about what's really in this bill, people say, I don't want any part of that. And they say that whether they're Democrats or Republicans. They don't want any part of taking away from our children, taking away from our seniors, taking away from people with disabilities, also that they can fund a handful of tax giveaways for the richest people in this country. So I know you all have had a chance to talk about parts of this, but this is our opportunity to get this on the record, to be able to push forward on exactly what's in this bill. So I just want to ask a couple of questions if I can. Donald Trump promised on day one, these are his words, on day one, he would lower costs for American families. Remember, he gets elected, and his very first interview, He's asked, what do you think? What do you think is the reason you got elected? And he tells the interviewer, it's because of costs. And I promised on day one to lower those costs. Within 6 weeks after he has been inaugurated, he does an interview. And the reporter says, these tariffs that you're about to put in place, you realize those are going to raise costs for American families. It's going to make it more expensive for the things they buy. And his answer was that he couldn't care less. That's where we went. So I want to look at this tax proposal that the House is working on right now a little bit in that context. And that is, let me start with you on Head Start. Talk just a little bit about who's using Head Start and what it means if families are denied the opportunity to use Head Start. So Dr. Sullivan, you used to lead the Administration for Children and Families, the HHS office that oversees Head Start. Can you talk for just a minute, just give everybody the overview about what the cuts mean, but also a little bit about what it means family by family, if you could.
Yeah, thank you so much for that question.
Pull your mic a little closer. I want to make sure everybody hears you on this.
Yeah, so I think, just to level set, we know that Head Start serves children, 800,000 children currently, in low-income households by preparing them for school and focusing on healthy child development.
Right, and can I stop you right there? 800,000 children are served by Head Start every year. Is that the total number of children who would benefit from Head Start?
Absolutely not. I think that's a theme across all Administration for Children and Families programs, but certainly, it only serves a small fraction of children.
So we have already underfunded Head Start. The reason we don't have more babies in Head Start, the reason we don't have more little kids in Head Start is not because the program's not good or because as many people as sign up just topped out at 800,000. That's as much money as we've put into it. So do people fight for those Head Start spots? Were they fighting for those Head Start spots before we got into the current cuts?
I think, again, the demand far outweighs the supply.
Okay,
So
so
yes.
long waiting list, people trying to get on the list, trying to get their babies into Head Start. And you were just about to say, because what does Head Start do?
Yeah, so again, an evidence-based early childhood development that really addresses development across all aspects of a child's development, from their health to social, emotional to educational.
Right.
It
And when you
also-
say evidence-based, just remind everybody, what does that mean?
So, this Head Start has been studied, for decades, and there is very clear evidence about the benefits of Head Start, which is everything from improved student performance, lower incidence of grade retention, higher educational attainment, higher rates of economic self-sufficiency, and improved health outcomes. These are just some of the benefits.
So
that Head
this
Start
is
has
just, we know the data are unambiguous about all of the ways in which the children who are able to get access to Head Start have better outcomes in life. Better outcomes when they first start school, better outcomes when they graduate from school, and better outcomes as adults.
Yeah,
Is that
and
fair?
I think that's absolutely fair. I also think I would point out that Head Start is also designed to support families and parents by doing job training and employment assistance, as well as wraparound services to get that to.
So not just the
really look at-
babies are getting helped, it's often the rest of the family.
Correct.
Yeah, are getting services through Head Start. Okay.
Yeah. So, it again serves children from birth through until they start kindergarten. And we've heard from so many kindergarten teachers that they can tell which children have attended Head Start because they really are starting school ready to succeed. So just an incredible program. I also think another benefit that is important to talk about is leveraging community partnerships. So other service providers, schools, local businesses that bring services to families that support parent employment and job training, as well as a lot of the contracts that Head Start works with. This is a really important service in every community around the country.
So what are the cuts doing now? What does it look like and what does the future look like? Let's do what they're doing right now.
Yeah, so as I said, I think there's a few things that are really happening right now with Head Start. From the very beginning, at the beginning of the new administration, they announced a federal funding freeze, which we know just caused a lot of chaos across Head Start programs that either had to temporarily close or nearly temporarily close.
So we actually
causing
have
a lot
Head
of
Start
issues.
centers that have had to turn off the lights. Is that right?
Temporarily, yes.
Temporarily?
Yes,
Uh-huh.
yes.
And what happens to the babies when they turn off the lights temporarily?
So, I mean, there's not a place for them to go, which means parents, right, who are working and, you know, unable to miss work are scrambling for last-minute childcare or forced to take a day off
Okay.
work.
So parents are now in the position, thanks to this efficiency from co-presidents Elon Musk and Donald Trump, parents are scrambling. They either quit their jobs or cut back on their hours, right? Or they find some other childcare arrangement. Is there plenty of other good, high-quality childcare available?
I mean, I think we all know that that is also an area where we need a lot more safe and affordable
Okay, so
childcare.
they find other childcare if they can. They have to worry about how to afford that, or they put their children in substandard care, which I take it means parking them with a neighbor perhaps, and way too many children put in front of a television set all day long. Is that a fair description of what these parents are facing?
I mean, again, as a parent myself who's had to scramble for childcare, I know that sometimes options are very
Okay.
difficult.
So already we're watching, thanks to Elon Musk and Donald Trump, we're watching the cuts go into effect. And now talk about what's in this big, beautiful bill that is so big and so beautiful that they want to rush it through in the middle of the night when nobody's paying attention.
Yeah, well, I think, I mean, when it comes to Head Start, as you pointed out at the beginning, we do not serve enough children. And I know in the previous administration worked hard to really talk about that need and the need to invest further in Head Start, and we're just not seeing that
Yeah.
in this bill.
So we're seeing what could be, if this bill goes through in the versions that you've seen, will we see Head Start that will not just close temporarily, but Head Start locations that may have to close permanently?
I think it obviously would depend on the details, but what I can say is I know that at least right now, a lot of the actions that are taking are making it harder for Head Start programs to do what they need to do, whether it is from the funding freezes, whether it is from loss of regional offices and staff that are able to help, whether it's delayed funding awards. I think we've already seen an impact to Head Start, and I'm worried about what may happen.
You know, I just want to say on this, there are times when you do have to make hard choices. I get that. There are times when you don't have enough money and you're going to make a hard choice at the grocery store. You got to make a hard choice on what you're going to do in your life or with your business. But here, cutting funding for our babies so that the parents may lose their jobs, so the children will be in substandard care and not get the kind of boost that we know Head Start can give them. And why? So that Jeff Bezos can buy a third yacht? That's bad. And this is the moment that we have to point out the kind of choices that the Republicans want to foist on the American people. Frankly, I just don't know anyone who says they think it's a good idea to shortchange our children so that a handful of billionaires who already have more money than they could spend if they were burning money every single day, that they should get tax giveaways. So I just want to say how much I appreciate, I got lots of questions for everybody, but I'm going to give other people a chance to ask them, but how much I appreciate the work you were doing as part of your public service to try to make this country work, not just for a handful at the top, but make it work for everyone. I am grateful to you for what you've done, and I'm grateful to you that you come back now on your own when you're not in those jobs anymore to say, I saw it up close and personal, it worked, and now Donald Trump and the Republicans are trying to break it, and I am here to speak out and say no. So thank you very much for being part of that. Thank you all. Thank you.
Thank you, Senator Warren. We have Leader Schumer next.
Well, thank you, Senator Alsobrook, for having this important hearing. And I know it's been said before, but let me say it again. Republicans don't want the public to know what they're doing. And so we can't have real hearings where people like you should come before, and they should be listening to you more than us. But they don't, so we're having these spotlight hearings so all of America can see what's going on. And since these are live streamed, tens of thousands, even hundreds of thousands of people are seeing what's going on. And it's part of the big lie. You know, they know cutting these agencies, cutting these programs like Head Start would be unpopular. So instead of saying they're cutting the program, they fire the people. The classic was Social Security. They want to end Social Security. They can't say they want to end it, so they strangle it. Close the offices, fire the people. Don't even let the phone lines or the emails work. That's what they're doing here. When there are 20,000 fewer people at this agency, it's not a 30% cut. Most of these programs will have a rough time even going forward, period, when you cut that many people and everybody has to scramble. And then you know what they hope? They hope the people who are there, who are dedicated public servants, become so exasperated because there are so few people that more of them quit. And unfortunately, we're seeing the number of people who are voluntarily retiring increase, not because they don't want their jobs, but they know they can't do the job with so few people there. So it's just an outrage. It's just an outrage. And we know what they're up to. End help for people, as Senator Warren said, so they can give taxes to the billionaires. You know, so each of these billionaires can have a yacht on each ocean instead of just 3 oceans. The bottom line is that we are here to show the American people exactly what's happening. And Abraham Lincoln said it best during the height of the Civil War, when the country had lots of trouble like we have now. Public sentiment is everything. That's why we're here. Public sentiment is everything. The average person, Democrat, Republican, liberal, conservative, independent, they don't want to see Head Start hurt. They don't want to see our drugs not tested so they might not be safe. They don't want to see fewer people, I know this is HHS, but in the Social Security Administration so that they don't get their services. The American people don't want to see it. They don't want that to happen. No, but the administration doesn't want them to see it, is what I'm saying. But we're making them see it. That's why we're here. That's why we have this spotlight. Public sentiment is everything. And if we keep at it, and we will, we do things like this every day. I think today there are 2 of these spotlight hearings. Public sentiment will change America. And people will see how vicious, how nasty, how uncaring about average folks, about working people this new administration is. I've never seen anything like it. And let me tell you, what goes around comes around in the sense of politics, and people are going to realize what's going on, and those in the Congress, the collaborators who go along with all this, even though some of them know it's wrong, the conspiracists, the co-collaborators, they are going to be seen by the American people in a highly unfavorable light, and public sentiment will then be everything. So thank you. I know I've worked with 3 of the 4 of you while you were in your jobs. You're dedicated public servants. You do a great, great job. I'm sorry you're not there now helping people, because that's your mission. You could have gone off and made a lot of money like all those billionaires surrounding Trump, but you care about people. You're good people. Thank you for all your service. We appreciate it.
Thank you, Chuck. Senator Cortez Masto.
Thank you. First of all, I have to thank my colleagues, Senators Baldwin and Welch, for holding this shadow hearing today. And we can all agree. I mean, it's outrageous what we're seeing in the health care cuts, the mass firings from this president and Secretary Kennedy. I was looking at this list here. Every single one of these services, I can tell you somebody in Nevada was touched by, and I know who they are. This is why this is so essential. That if this is not unique to Nevada, every community across this country relies on these essential services to help people in our communities. And I like my colleagues, I think it's just outrageous what we are seeing. It's really kind of cruel and thoughtless. This isn't a strategic, well-thought-out plan, how we streamline government, how we work with Congress so we're not causing harm, but how we are identifying where we can make gains or streamline or cut out some waste. This isn't what this is about. And I can tell you, anybody who's ever even worked in corporate America knows this is not how you do it. And what is happening here is actually going to be creating long-term pain for so many people and businesses across this country. They have no idea, and we're going to have to fix this as this administration moves on, because they will. we are going to have to figure out how we address this and reimagine that relationship and how we help others. So I appreciate all of you taking the time to be here because I know how busy you are. And like my colleagues, thank you for what you have done. Thank you for your commitment to address so many of these concerns and issues that we're seeing in our community. Thank you for coming out to Nevada. I know so many people here in the panel and then in the audience who have been to my state as we talk about our children and our families first and how we bring healthcare and bring it into our urban and rural areas as well. So let me start on a couple of questions, and maybe Ms. Johnson, I'd like to start with you because I know in Nevada from our community health centers to maternal health programs to rural health services and workforce development, HRSA really oversaw a wide range of healthcare access initiatives across the country. But when we see somebody like Secretary Kennedy coming in and making these just wholesale cuts, no thought to the staff that are there, the services that are being provided, when agencies are absorbed and technical staff expertise is lost, because we need that, what critical functions or knowledge do we risk losing in this space, and how might that affect program effectiveness and oversight?
Thank you so much for the question, Senator. And I think you have just hit the nail on the head about what we're losing. We're losing not only the arbitrary decisions they've made about just firing people because they could wipe a box off of an org chart, but also they've created a climate where they've really encouraged an environment where people, are making the choice to take early retirement because it's a very difficult environment. And if you're dedicated to a public service mission and you don't see the path forward for being able to deliver on a public service mission, people are rightly making choices for their families. What that means is that the decades of knowledge and expertise about what it takes to actually deliver a maternal health program on the ground. What is cultural competent delivery of services? How do you work closely with your tribes? How do you understand the community that you're delivering services in? It's not about just putting words on paper and sending it out. It's about being a partner with a community to be able to change the dynamic around maternal mortality, to change the dynamic around rural hospitals being able to stay open, to change the dynamic around people actually getting preventative care so that the chronic disease challenge actually comes down. And so that's the expertise that we have built up over time. That is the place, that's the culture that has been created at HRSA. As my other colleagues have mentioned, HHS scores incredibly well on surveys about employee satisfaction because it's a culture where people are dedicated to the mission. And then when in this environment, the arbitrary and punitive and really just inhumane nature of these actions has just sort of left us now without that expertise and without that real skill about being not only a scientific expert, but also a community expert.
And a couple of things. Would you say that the money that we spent over the years in these programs for the staff to do the work that they do is well spent, or was it waste?
Oh, it is absolutely well spent money that is delivering services on the ground in community. Communities are healthier. Communities that struggle to get healthcare providers have physicians now. Hospitals are staying open that were threatened with not being able to remain viable because these kind of resources are there. You've seen the incredible numbers of the difference we're making on the opioid overdose deaths, the way that we have begun to stabilize maternal mortality. We have a lot of work to do on all of those issues, but things are changing because we've made these kind of investments.
And then can you address, well, first of all, we already have a workforce shortage when it comes to healthcare. We are addressing in Nevada, we're addressing across the country. So what happens when we start closing these regional programs? What does that say to the future workforce that we want to bring back? But then also, what does that do for particularly anyone that is seeking help or appointments in these programs to get access to that care and that quality care? And let me just put a finer point on this. Not just in our urban areas is this going to be a challenge, but our rural areas. If you're in Nevada and you're in a rural area and that rural clinic closes or that program closes, you may have to drive 4 hours just to access another program. And that's you're lucky if you can do that and still have a job, right? So there are challenges here with what is happening here, what is not thought out when it talks about geographic challenges and access to care across the country. But what does that say to our workforce? That, like, we don't care about you, so will they be there in the future if we decide we absolutely need these programs, we want to hire people back? What are they going to be thinking?
Well, I think for the federal workforce, we have sent a clear signal. A clear signal has been sent to them about the value of their work, and the really inappropriate language used to describe their work in the notices that were sent to them, the way they've been treated in this process has just been incredibly insulting to people who've made their mission public service. And a signal has been sent to young people about what public service looks like then, that people can treat you this way when you dedicate your life to public service. It is true that people can make a lot more money in other places, but they choose this line of work. We want people to continue to do that going forward, and we have now created an environment where that's going to be very, very difficult. I'm hopeful because there are a lot of young people that I talk to who are still interested in public service and anxious to find ways. They're going to states now. They're trying to find ways to be able to serve. But it is a very big challenge that we will see going forward. And just to your second point about the healthcare workforce, the irony to me in much of this is that every time I testified in my role as HRSA administrator, people from both sides of the aisle asked me about the shortage in the healthcare workforce and what more this Congress could do to help address the shortage in the healthcare workforce and help us at HRSA train more people. And so to look at the president's proposed budget for fiscal year 2026 and see all of our rural workforce programs going away, all of our nursing training programs going away, all of our programs that recruit young people into the health professions going away is really just in stark contrast to the tone and tenor of every conversation I've ever had in this body.
Yeah, and I have to say, there's this other point to the work that so many do in our communities in these programs. And I'm going to put a fine point on it because it wasn't until I actually did a ride-along with one of these, I did a ride-along with Meals on Wheels. And I think you have to see the work that is being done by the federal workforce in these programs to appreciate what they bring. It is not just the service. It is the emotional connection to people who might not otherwise have it. Most people don't know that if you're delivering Meals on Wheels, you're a connection to a senior that probably doesn't have a lot of interaction and sometimes maybe only in their home and that's it, and they're waiting for that interaction. It is also an opportunity to check on seniors if something is wrong or if they are not answering the door. That person that does Meals on Wheels is paying attention and is a lifeline to some of these seniors. It is true for this entire workforce, the entire workforce that we're talking about in every single one of these programs and the programs that are being cut. There's another human connection there that is essential, that we get a benefit from, that is worth it than what these cuts are happening. Let me do one final one. I'm going to leave it to my colleague. Ms. Brooks-LaSure, thank you as well. Thank you for everything that you have done. I know working with you, you've helped us in Nevada as we address both our Medicare and Medicaid services. Let me ask you this. Which parts of CMS do you think are most at risk because of the changes that this administration is doing with the cuts and the closing of the regional programs and regional offices? What should we be thinking about?
I would say a couple of things. So many of the way people experience CMS and how they get help is actually through our regional offices. The regional offices around the country are usually the first line of defense when somebody has an issue in the Medicare program, in marketplace coverage. Those are the people who often resolve the issues. And so that is probably what I'm most concerned about in terms of the people that have been let go. Some of my colleagues have lost more from their staff. CMS has been now tasked with absorbing more responsibilities, and so I think that's also the tension of having more responsibilities with fewer staff. But I do think that a greater threat is the House Reconciliation Bill, which is going to put a great deal of pressure on people who are reliant on Medicaid and the Affordable Care Act, and importantly, on our healthcare system at large. Our hospitals, we were just talking about our underserved providers, they get so much of their funding through these programs. And I'm really concerned, first of all, about just the size of the changes and the cuts, what that's going to mean for people across the spectrum, both low-income and middle-income families, as well as, again, the healthcare providers with having fewer staff to help with these additional red tape provisions that have been put in place.
Yeah, I appreciate that. As we're going through the reconciliation budget of this administration, there's always this conversation about, usually a budget coming out of the administration is what they value. The budget, the reconciliation is what do they value in this country. And it's pretty clear, based on the programs they're cutting that go to hardworking Americans, individuals that are most vulnerable, those people that actually keep the lights on for this country. Not only are they seeing cuts to services, the tax cuts for them, whatever little tax cuts they're going to get to hardworking Americans, the middle class, as well as those small businesses, are temporary. The tax cuts for the big corporations and the billionaires are permanent. That's exactly what this administration values, and it's pretty clear. And it's going to devastate this country, and so many people are going to be harmed by it. I thank you all for being here and speaking out, and thank you for all the good work that you have done over the years. I appreciate it. Thank you.
Yeah. Senator Van Hollen.
Thank you,
Thanks.
Senator Welch, and thank you for co-sponsoring this, bringing us together with Senator Baldwin and others. And thank all of you for your testimony today. Thank you for your longtime efforts in the area of public health. And I agree the immediate threat is the bill that's making its way through the House of Representatives, this huge tax cuts for very, very wealthy Americans, people like Elon Musk at the expense of everybody else, including the cuts to Medicaid, food nutrition programs, and other things. And thank you all for spotlighting that. Those are harms people will feel directly and quickly. There are also harms that people will experience, but they may not know what the source of those harms are. And I do want to focus a little bit on FDA in that regard, Dr. Califf, because as you pointed out in response to the mass firings, quote, the FDA as we know it is finished, unquote. And you go on to point out that the Trump administration's proposed restructuring and staffing cuts at FDA will ultimately harm patients and innovation. So could you elaborate on that? Because these are harms that people are going to experience. They won't immediately know what the connection is to these, draconian cuts in terms of federal employees and the changes that are taking place at FDA, but they're going to have very harmful consequences. If you could please elaborate on all that.
Sure. Well, my that quote came from an airplane flight I was on where my messages exploded from FDA employees who had been fired with no warning and no explanation. Many of them doing absolutely critical jobs. And as I've tried to emphasize through this whole discussion, I think your point about people may not know where it comes from is a really good one, because an example where they would think about it is in a food outbreak, which is a likely risk if we don't have enough inspections and enough people in the middle who deal with the states and the counties, because it takes a collaboration across all those entities in order to have a secure and safe food system. But mistakes made because of inadequate numbers of people with expertise early on in drug development or device development. We're in this era now. Actually, Senator Cortez Masto just left, but I'm headed to Las Vegas for a meeting next week of the Chan Zuckerberg Initiative in Rare Diseases. And it's an amazing time. These parents of children who had no hope, now, if enough resources go into it, with the right guidance, there can be treatments for diseases that were untreatable until just now. But for that to work, you've got to have a whole series of evolution of the technology, guidance about how to do the right clinical trials, how to make sure the manufacturing is done correctly and leads to a reproducible manufacturing. So the end result may be there's no treatment, for a disease, you wouldn't think, well, it was because actually there weren't enough people to help the industry in its development path. But that would hold true for high-end devices, which are now in development using artificial intelligence. Tobacco is another one where parents may wonder about their children. All the people that were doing the enforcement on convenience stores selling tobacco products were fired. And in a very strange way to handle things, they get fired and then they get hired back when it's found out they were actually needed. That's not a way to do it. So, so many ways. When you're regulating 20% of the economy, there's a lot of harm that can be done, and it's not always obvious what the incident was that actually started the chain of events.
Right, so just to elaborate on all that a little bit, no one should be surprised when you take the cops off the beat that, bad things can happen, which is what they did. You pointed out that if you don't have the people power to review some of these proposals, new devices, new drugs, there may be cures out there, potential cures that we never actually benefit from. There's also the other side of the equation is there's no people there, so people may try to rush through things without expertise. And one of the things that FDA has really been the gold standard for is two things: safety and efficacy, right? You want to make sure that what you're taking is safe, and you also want to make sure it's effective, it does what it says it's going to do. And what are the risks that if we don't have people in place, experts in place, that things will get on the market that are neither safe nor actually do what they say they're going to do?
Well, anyone who's been involved in medical product development, I think, completely understands this. We use the term safe and effective as shorthand for something that's much more complicated. No medical intervention is entirely safe, and effectiveness depends on in whom the treatment is used and what that balance is for the individual based on the clinical trials that are done to elucidate the balance of risk and benefit. I'm a cardiologist, did a lot of my work with antithrombotic drugs where there are two sides of the coin, bleeding and prevention of blood clotting. And in some people, the risk outweighs the benefit, and in others, the benefits far outweigh the risk. Knowing how to guide companies through that balance takes not only expertise in a variety of fields like biology, bioengineering, biostatistics, et cetera, but also experience, because since most things don't work and the risks outweigh the benefits, picking out the winners and guiding them correctly is something that requires judgment. If you get rid of the people who have the experience, you're just by design going to take a bigger risk. It's like, if you're going to drive somewhere without Siri or Google Maps, if you have someone who's never been on that road before, you got a real problem trying to figure out where to go.
Yeah, right. This doesn't make anything more efficient. It just makes things more dangerous and increases the risk for the American people. So thank you for your long-time service there, and really thank all of you for the good work that you've done for public health. Thank you, Senator.
Well, we all thank you. I mean, the last thing I just want to say, I'm inspired by what you've done and you hanging in. And I think for all who are listening, sharing our dismay at the unraveling of this extraordinary healthcare system that you've helped improve, you're giving us some hope. And if for nothing else, we've got to hang in. We can't let slip what you work so hard to create. So thank you very much for what you've done and what you're doing today. We're all in this together, and we've got to maintain those community health-based services. We've got to have some confidence among people that if they get sick, there is a healthcare system that they can rely on and get the help that they need. So thank you so much for coming to the Spotlight hearing, and I want to express the gratitude that Senator Schumer and every single one of us in the Senate has for your being here and for the services you've provided. Thank you.